A very good afternoon to everyone. Welcome to today's session on role of vitamin and mineral supplements in children. To speak on the topic today, we would like to welcome Dr. Susanta K. Badatia, our in-house consultant for neonatology and pediatrics. He has done his MBBS, MD in pediatrics, and DNB in neonatology. We welcome you, Doctor. You can now take over the session.
Okay, thank you. Thank you for the opportunity Apollo is giving for discussing these very important topics. In this Facebook Live session, today we are going to discuss about the vitamin and mineral requirement in children and the prevalent myths among the parents associated with the vitamin and mineral supplementation. So, as we know, nutrition in babies mainly depend can be categorized into two categories. Like this may be macronutrients and maybe micronutrients. Macronutrients means these are the building blocks that baby needs in their diet. That like fats, carbohydrate, proteins. These are the main factor that provides the energy, the building blocks to the formation of the bone, muscle, etc. But the micronutrients, these are the vitamins and minerals that are helpful in utilization of the macronutrients. So the enzymes which are very much needed to carry out the functions of the organs, and so these are the micronutrients that are very vital. So they are called the vitamins. And the catch point is that these are not, every vitamins are not synthesized in our body. So most of them are not synthesized in our body. So they are dependent either on external sources. External sources means most of them are the diet. So some are like vitamin K or vitamin D. They can be synthesized in the body, but they need external help. So today I will first discuss about the type of vitamins and minerals, the resources from which baby can get, the signs of deficiency which parents and physicians should look into during the physical checkup, and what are the myths associated with the vitamin supplementation or mineral supplementation. So uh, we know the minerals that are important in the body are mainly calcium, sodium, potassium, the phosphorus, magnesium, iron, most important the iodine and zinc. These are the minerals we are interested in discussing. So first is the calcium. Calcium basically important for the formation of bones, teeth, and functioning of the enzymes. So like all muscle mass in the body, like skeletal muscle or a heart muscle, or these are very much in need of calcium. So for the contraction of the muscle mass, they need calcium. So for clotting of blood also, they are very much helpful. They are the vital part of the body. So these are the requirement of calcium in the body. Second, iron. Iron is the main constitution of the hemoglobin that is needed for the oxygenation of the body. So metabolizing enzymes are also in mitochondria. They're also dependent on the iron part for their functioning. Iodine, we all know, is the important for the formation of thyroid hormone. So they are mainly helpful in formation of the brain, develop brain. So these are thing we should not be deficient in the baby's diet. So similarly, fluoride and zinc. Zinc is also important for growth and immunity. And for fluorine, we know that teeth and bone formation are dependent on fluorine function. So, and at last, the sodium, potassium, these are the minerals we need for the maintenance of the blood pressure, maintenance of the water balance in the body. So during any diarrhea process and the dehydration, we are more focused on not only water part, also the these two important mineral functions. So basically, uh, these are all available through our diet, but they should be ensured that baby is getting this diet. So next comes to our mind, what vitamins do baby need for their functioning. So there are two types of categories of vitamin in our system. The first is the fat soluble vitamins, second is the water soluble vitamins, basing of their physical properties. So fat soluble vitamins include vitamin A, D, vitamin E, and vitamin K. And water soluble vitamins include vitamin B and B complex and vitamin C. So vitamin A, main source of vitamin A is the green leafy vegetables. The more the green content of the vegetable is, the more content is the vitamin A. So otherwise, the animal sources, they are poor source of vitamin A. They need to be fortified. So like fortified milk, fortified ghee, they are can be a good source of vitamin A. Otherwise, green leaf vegetables are the main important source of the vitamin A. Second, vitamin D. Vitamin D is the no dietary sources are very good in vitamin D, except the animal sources. Animal sources like liver, egg yolk, and the fish and fish liver oils. These are the rich in vitamin D content. Otherwise, the main source of vitamin D is the synthesis on the skin by help of sun rays. So sun rays help in conversion of the vitamin D in the skin, subsequently get absorbed in the bloodstream. So main source of vitamin D can be taken as the sunlight in our setup, in addition to the animal sources like liver and fish oils. So vitamin K, these are the synthesized inside our gut by beneficial bacteria, and by birth we always supplement the vitamin with vitamin K. Apart from this soluble vitamins, fat soluble vitamins, the second source comes the vitamin B complex and vitamin C. So vitamin B complex is abundant in our diet source like green leaf vegetables and the milk, eggs, and liver and the fish content. These are also rich in the B complex part. Particularly vitamin B12, these are rich in animal sources. So in addition to these vegetables and animal sources, the cereals also contain B complex. Although in content wise, the strength of the vitamin B complex is less in cereals, but as we consume more of cereals, so they become an important source of vitamins B complex in our diet. And vitamin C, the fresh fruits, fresh citrus fruits, these are the main source of vitamin C in our diet. So and these are the and for the mineral sources, we should know that the calcium is very much abundant in our milk and milk products, and the vegetables, cereals, they like ragi. These are very good sources of calcium in our diet. And for iron, the two varieties of dietary sources. First is the vegetable sources like cereals, green leaf vegetables, jaggery, dried fruits. These are the vegetables or plant sources of the iron in our body, but these are poorly absorbed. So the bioavailability or the net gain from these sources are not much as compared to the animal sources. For animal sources, for animal sources, the iron is better absorbed. So the heme iron, like in liver, meat, the poultry and fish meats, these are the very rich source of iron. So uh, and so pure vegetarians may be at a higher risk of iron deficiency unless we plan them for better nutrition. So apart from these iron sources, know that the common salt is a very good source of sodium, and similarly iodine. Although in food material we get less amount of iodine, but there due to fortification of the common salt, these are not seen. The deficiency is not seen much nowadays. Seafood is a good source of iodine. So we should know there are some inhibitors of iodine in our diet source. So even if we are not getting iodine, you should not take the inhibitors of the iodine in our diet source. So like cabbage and cauliflower, they can inhibit the absorption of iodine in our body. And similarly, fluoride, the our water source, they contain good source of fluoride. If not, we can judge accordingly by fortification and assessment. So now coming to the what are the deficiency signs of minerals and vitamins in our body. So for as far as vitamins are concerned, first, as we discussed, vitamin A, the main function is the vision and the epithelial functions. So first, maybe we notice the signs of deficiency like dry eyes, the thickening of the skins of the body. So like if the advanced stage of vitamin A deficiency maybe has reached, then there may be some ulceration in the cornea. There is maybe a brownish spot in the, due to xerosis of the conjunctiva. So, and in addition to these skin and vision problems, the late findings may be the night blindness, and frequent respiratory infections also result from the vitamin A deficiency. So, and for B complex deficiency, we notice that there may be poor appetite, weakness due to poor nervous function. There may be delayed development of normal milestones. There will be irritability. So unexplained irritability and poor appetite may be as underlying signs of vitamin B complex deficiency. So, and the angular cheilitis, that is source in the lips and tongues, are the usually marker of vitamin D deficiency. So nerve related complaints like tingling sensations, burning sensations, and these are also one of the signs. As far as vitamin C deficiency is concerned, there will be manifestation of the swollen and inflamed gums and swelling. There will be bleeding upon touching. There will be easy bruising, and there will be pain in the legs while moving. So these are the vitamin C deficiency signs. Vitamin D is like vitamin D that leads to the poor formation of the bones and teeth. So delayed dentition, there will be the bowing of legs, like formation of deformity of the bones. So these are the vitamin D deficiency signs in the body. For mineral deficiency, as vitamin D and calcium both are important for the formation of the bones. So calcium deficiency also manifests as the same as a vitamin deficiency. In addition to the muscle manifestations like cramps and fits in the vitamin calcium deficiency, in addition to the vitamin D deficiency. So, and as far as iron deficiency is concerned, it may range from frank anemia in the baby, or there will be subtle signs like tiredness, lack of concentration, irritability, poor appetite. So presence of good hemoglobin is important for these functions like intelligence. The oxygenation is good, so the baby is not tired easily with exertion. Similarly, for iodine, there is lack of iodine in diet will lead to the hypothyroidism, leading to delayed development, swelling in the neck like a goiter, and not there is linear growth in the baby. So there will be stunting. So these are the deficiency of iodine in the body. And for sodium potassium, there will be tiredness, there will be weakness, muscle cramps, and These are the signs we get during a dehydration process. So basically, minerals and vitamins, but if we are not getting it through right composition, then these are the things we can encounter. So next, the vital questions comes our mind. Do my baby need vitamin or mineral supplements routinely? So as far as routine supplement is concerned, only preterm babies, those lack the transfer of the vitamins from mother to baby during last trimester. They need routine supplements of vitamin minerals for few months post birth. Apart from there, no need of routine supplementation. Some conditions where there may be routine need of supplementation, like post recovery, and if there is any deficiency signs in the body, then only there will be need of routine supplementation. Otherwise, if baby is consuming a balanced food, then it should get all the vitamins and minerals in the body, baby, in the diet. So before you jump into the routine supplementation from your relatives or something like that, you should discuss with your doctor whether baby is in need of any supplementation. If not, it should not be used. These are not simply appetite stimulant as perceived by many parents. So what are the myths associated with then supplementation? They parents consider vitamins and minerals to be a magic pills, so that my baby will be stronger or baby will be performing better with the supplementation, and I'm doing something for the baby. They feel like that, but this is not true. Only if there is deficiency, then only these supplementation are going to help. Like iron, they do help in gaining the appetite and the memory function, that only if there is a deficiency of iron. In iron deficiency there will be lack of functioning, so if we supplement iron, then these will boost the appetite and strengthen the memory, that like that. And some parents think that supplementation of vitamin A will lead to correction of refractory error. My baby's vision will be better, but these are not true. Only if there is deficiency, then it will improve the eyesight or like that. Other, not eyesight, only the vision in the dark vision, like the energy deficiency. So not for the routine improvement in the eyesight or refractory error. And vitamin C, as we see, we have experienced during this pandemic, these are taken as left and right to improve the cough and cold part. So this is not like that. They don't prevent cough and cold. During and respiratory illness, they may be a better perform of respiratory function due to vitamin C, the antioxidant part. Otherwise, they are not for preventive purpose. Similarly, pumping extra vitamins and minerals are not going to give immunity. So parents are very much of apprehensive that give something to improve the immunity. These are not directly immunity boosters. So as we know, anything in excess is poison. So we should be wise enough to use the vitamins in a regulatory amount. Um, so we should not be we should not be using excessive of anything, and always consult your doctor. If they prescribe, then only you should use the vitamin supplements. So that finishes our discussion. I will now take some questions what have you posted. So first question is, what are the most important vitamins for a child? So every vitamin has its own function, like we have discussed. Vitamin A, D, E, K, and vitamin B complex and C. Anything cannot be skipped, but there should be blended. So these are the, as we discussed during our talk, that the importance of each and any component. So, and should toddlers take supplements? So apart from first year of life, where we routinely advise vitamin D supplementation, and there is no other routine supplementation except if baby is not baby is getting only breastfeed, then after 4 months, then we are supplementing with iron. Otherwise, the preterms only take supplements. So no routine supplementation of vitamins and irons in beyond 1 year of life. So depending upon the case to case basis scenario, your physician will advise. So how to choose vitamins for kids? So as we say, as we discussed, the diet should be balanced diet. So first, the plant source and animal sources. If some parents are only pure vegan or vegetarian, then they may lack iron and vitamin D types of vitamins. But they, if they take the green leaf vegetables and they can plan out their diet, then this can be also mitigated. So do kids have different nutrition needs than adults? Definitely. During the childhood, there is rapid growth in both in somatic growth and the developmental brain growth is there. So they have their phase of growth is excessively demanding of every nutrition, macronutrient and micronutrient. So their diet should be very much balanced. And the any deficiency signs, we should be getting checked up during the consultation, nutrient vaccination or like that, so that they can be picked up early. How to ensure that baby is getting enough nutrients? So if baby is growing fine, active, playful, and there is no signs of development delay, so that means baby is getting enough nutrients. So routine checkup, during routine checkup, we always do physical examination and the growth monitoring. So if the baby is doing well in their, according to their centiles, not always that my baby is chubby like compared to the neighbors, my baby is heavy, that means the baby is healthy. So baby should be growing nicely on their centiles. So then we are ensured that baby is getting enough nutrients. So next question: can these added supplements have only side effects on the growth of kids? Yes, not routinely any vitamin or vitamin supplements have routine side effects. But if there is the excessive, like if there is the excessive of vitamin A in body, there may be increase in pressure in the brain. Then maybe the intracranial pressure may rise. So similarly, if there is a vitamin D excessive in the body, so similarly there may be a rise in the pressure in the brain, and in addition to that, there may be stone formation in the kidney. So similarly, as the vitamin B complex and C are that are water soluble, but anything excess should not be encouraged. So yes, these are very safe supplements to take if indicated, but if taken in excess, then there may be detrimental effect. Is extra protein dangerous for kids? Yes, extra proteins are not going to benefit baby in any way. So whatever the daily requirement, that should be taken only. So that comes to a end to our session, where we discussed the need of vitamins and minerals in our routine diet, and their deficiency and the myths associated with the supplement. I think we can stop the session now.